We've been involved in creating what's known as the Further initiative. Further is an acronym for the Future of Respiratory Health Readiness. The Further initiative is a globally relevant effort to address the gaps appearing between what is ideal care and what is everyday care and practice. And the initiative also seeks to shine a light on key issues in the future landscape of chronic respiratory disease. Asthma is a chronic, incurable condition that can affect both children and adults. It is estimated that over 300 million people suffer from the disease worldwide, and for a variety of reasons, its prevalence continues to increase. Personalised treatment plans and proactive asthma management are key factors in gaining control of the condition. Several barriers, including biological, behavioural and environmental factors, limit the demand for and the supply of treatment and make adherence to treatment a challenge, hindering efforts at asthma control.
These respiratory conditions are long-term conditions, and so I think we should set goals and expectations for ourselves as healthcare professionals to help the patient progress on their journey over time. And sometimes they might be little steps that we make along the way so that we have long-term change.
One challenge is the lack of holistic, personalized care.
I think it's very important to remember that people suffer multiple diseases nowadays, what we call as multi-comorbidities, especially among adults and older adults. And when we talk about multi-comorbidities, it is very important to remember about patient-centered care or person-centered care. Not just from the person perspective, but also from the healthcare worker. So one of the problems with, all these clinical practice guidelines that we have is that it's very siloed, and yet the person delivering the care is this one single doctor or one single nurse.
I do think, though, that there are added challenges in delivering personalised care to people with asthma or respiratory conditions in particular, because at this point, really, the reality for most healthcare professionals and people living with asthma is that the outcomes are closely linked to what the patient is telling us about their disease. And I think we have such an ingrained way in which many people with asthma deal with their disease, and an ingrained way in which healthcare providers interact with people with asthma, that we sort of need to break that cycle in order to really get down to delivering personalised care. Because often a patient with asthma, when they do come to their healthcare professional, knows what they should be doing, or thinks they knows what they should be doing. They're doing it the way that they want to be doing it, which is probably not prioritising it.
There is also a need to redefine patient empowerment. Advocating for patient empowerment is not about patients having decision-making autonomy on when to take their medication or react to symptoms, but about equipping them with the resources and tools to better understand and manage their condition through informed behavioral choices.
What I feel is empowerment is when the patient is able to influence their own outcomes, right? Along with the provider, along with the caregiver, they feel that they are in control of the disease. They're able to manage their disease much better. They're able to understand what are the trigger points that is personal to them, and be able to kind of modify their behavior for a better quality of life.
Some patients actually think that they're not going to be able to do their usual run because they've got asthma. Some patients think that that's actually normal for people who are living with asthma, whereas of course that is not what we aim for. Our goal is that every patient who has asthma should be able to live sort of a full life without restrictions.
Despite challenges that still exist, the future of asthma care holds promise and potential. Digital health and health technology, accelerated by the COVID-19 pandemic, has seen a significant paradigm shift in delivering more effective and tailored asthma management support, especially for those under 65 years old. Our survey found that 76% of people living with asthma want to stay ahead of their asthma by managing their diet and sticking to their medication. 79% are hopeful about new and better treatment options in the future. 68% would like their health provider to tell them about newer and innovative asthma treatments, regardless of cost. Our research identified 5 key takeaways that we believe will be important to further progress in asthma care: refining patient empowerment through efforts around health literacy and behavioral change, a renewed focus on holistic, personalized asthma care, the development of patient-friendly and country-level guidance on asthma, the need for education of healthcare professionals around asthma care, strengthening two-way communication between providers and patients together with shared decision-making. To find out more about our research results, please go to thefurtherinitiative.com for the full report.